Good evening. I am Dr. Barbara Carson, President of the New York Coalition of 100 Black Women, Incorporated, and I am pleased to welcome you to this program. The New York Coalition of 100 Black Women, Incorporated, initiated in 1970, is the founding chapter of the Coalition of 100 Black Women, from which a national network grew. We are a not-for-profit organization committed to marshaling resources needed to educate, engage, and empower women, young adults, and children through our programs, activities, and events. We collaborate with corporations, elected and appointed officials, and with other community-based organizations on a range of issues of importance to Black women and their families. Coalition members are corporate executives, entrepreneurs, political activists, educators, healthcare providers, role models, mentors, and so much more. If you would like to learn more about the New York Coalition of 100 Black Women, Incorporated, I invite you to visit our website at www.cobwfounders.org. Or you can also like us on Facebook and follow us on Instagram. Now, on to this evening's event. Tonight, the Coalition is proud to present 4 dynamic physicians who will speak on the novel coronavirus and the pandemic of 2020 and 2021. The virus has disproportionately affected communities of color, and there remains much to be learned. That is why we are excited to present this program for those seeking information about the virus and the pandemic and how they continue to affect our lives. I would now like to introduce tonight's moderator. Dr. Jamilia Sly is an assistant professor with appointments in the Department of Population Health Science and Policy and the Department of Family Medicine and Community Health at the Icahn School of Medicine at Mount Sinai. She is also the Director of Anti-Racist Research and Community Engagement in the Center for Scientific Diversity and serves as the co-director of the program for anti-racism and equity for her department. Dr. Sly's research interests are centered on eliminating health inequities in cancer in underserved and minority populations. Dr. Sly has received grant funding to execute her research program from the American Cancer Society and the National Institutes of Health. I am proud to present Coalition member and tonight's moderator, Dr. Jamilia Sly.
Thank you, President Pearson, for that warm welcome and introduction. I want to orient our audience to the format of the panel discussion tonight. We're going to begin with brief presentations from each panelist, starting with Dr. Michelle Alexander, who will review the COVID pandemic and testing, followed by Dr. Ann Maitland, who will discuss treatment, vaccines, and special populations, and Dr. Stacey Yearwood will conclude by reviewing how mental health has impacted our communities during the pandemic. After the presentations, we will begin a panel discussion where I will ask each presenter to respond to some common questions that people have about COVID and the vaccines. I would now like to introduce each of our panelists, and then they will give their presentations. First is Dr. Michelle Alexander. She is currently the CEO of eBond Research Systems and the former medical director of occupational health at Consolidated Edison of New York. She completed her internship and residency at Kings County Downstate Medical Center in internal medicine. Dr. Alexander was also the Assistant Vice President of Occupational Health at the Metropolitan Transit Authority, New York City Transit, and has practiced occupational and environmental health for over 30 years. She is a certified medical review officer and believes strongly in preventive and natural healing. Among her many interests, she is an avid exercise enthusiast and nutritional junkie. In her spare time, she is pursuing the creative arts, which includes quilting, painting, crafts, beading, and jewelry making, and loves to travel. She has one son who is in his last year of college at Rochester Institute of Technology in Mechanical Engineering. Dr. Ann Maitland is a fellow of the American College of Allergy, Asthma, and Immunology, and a member of the American Academy of Allergy, Asthma, and Immunology. Her clinical focus is to upgrade efforts to meet the needs of underserved communities plagued by immune-mediated disorders such as mast cell activation disorders, such as anaphylaxis, asthma, and food sensitivities, as well as primary immunodeficiencies. She is the former past chair of the Committee for the Underserved of the AAAI, a faculty member of the Allergy Immunology Division of the National Medical Association, and the chairperson of mast cell disorders of the AAAI, and faculty member of the MCA Disorders and Subcommittee of Patient-Centered Outcomes Research Institute grant for patients diagnosed with the connective tissue disorder, Ehlers-Danlos syndrome. And finally, Dr. Stacey Yearwood is a board-certified adult psychiatrist and former chairperson for the Department of Psychiatry at Northwell Health's Long Island Jewish Valley Stream Hospital. Dr. Yearwood enjoys working at the interface of psychiatry and medicine. Of particular interest are perinatal psychiatry and the full spectrum of women's mental health. True health involves balancing physical, emotional, mental, spiritual, and financial health. Dr. Yearwood seeks to create appropriate balance in her life and thrives on assisting patients in finding balance in theirs. All right, we're going to begin with Dr. Michelle Alexander's presentation. Okay. Dr. Yearwood, are you ready to give your presentation?
Hi, everybody. I'm sorry. My son's, I was using his laptop and it crashed.
That's
The
okay.
things that happen when you're trying to do many things. Can you guys hear me?
We can hear you. Is it okay if maybe Dr. Yearwood does her presentation?
Can you hear me?
Yes, I can hear you. Can you hear me?
Oh, no. I don't think you can hear me. Hello? Can you hear me?
Yes.
You can. Okay. But I can't hear you. Okay. So I don't have the ability, I don't think, to share my slides. I'm going to try to see if I can do that here. If you just give me a second, I'm going to see if I can get hold of them to share the slides differently since I have to go on my phone. Just give me 1 second and I think I'll be able to do it. Okay. So it's that's if you can show if you can show my slides, I would appreciate it, Raven. My slides begin with the novel coronavirus pandemic 2020. You're showing Stacey's slides right now. Can you bring up my slides? Can you see me? Okay. So I'm going to talk today about the coronavirus and the COVID-19. We're going to basically cover just an overview of the coronavirus. Specifically, COVID-19 began and was discovered in Wuhan, China in the midsummer of 2019. It's caused by the SARS-CoV-2 virus. And this virus is a RNA virus, very, very tiny, very, very small, about 10,000 times smaller than a half an inch. So this virus that has caused so much damage is very tiny. The coronavirus family includes the severe adult respiratory syndrome virus and the Middle Eastern syndrome virus, respiratory virus. It's also the coronavirus is the same viruses that causes the common cold. The virus that we are basically experiencing now happens to be much more infectious and deadly than any of these other previous viruses that have been seen. And we know that it affects many parts of the body. The virus, if we could get the slide up, I could show you a schematic. Raven, are you able to get up my slides? Raven, can you get up my slides? I don't know. Okay, well, the coronavirus has on its surface a S protein, and the spike protein, which is they call it the S protein, is the protein that actually connects or attaches to the whole cell in your human body. Once it attaches to the cell, it causes basically a number of things to happen. It attaches to the nucleus envelope, enters the cell, and then hijacks the cell's mechanisms in order to produce more viral particles. This destroys the cell. And as a result of that, the body forms an immune response to this destruction. This immune response can sometimes be very, very intense. And it's called, many people have heard, the cytokine storm. That storm is an autoimmune response, meaning that your body is reacting to itself. When people get infected with COVID, 80% of them have either no symptoms or just mild symptoms. And basically, many people don't even know that they have the disease. But in 20% of people, they do get much more severe disease. This can be as simple as cough, fever, muscle aches, body aches, fatigue, loss of taste, loss of sense of smell. But in much more severe cases, this virus can attack many different organs in your body. It can affect your lungs, your heart, your blood vessels, your pancreas, your liver, and it can cause quite a bit of destruction and lead to much more intense disease, such as loss of, such as heart attacks and strokes, and even death. As you know, many people have ended up on ventilators and have died as a result, especially early on in the disease. We know that the disease is spread by respiratory droplets. That means that when you cough, when you sneeze, when you speak, the virus is aerosolized in the air, and that air you breathe in, and that is how it attaches to receptors, tiny receptors in the nose and the throat, and even in the GI tract. As a result, that attachment, it can go deep into the body and cause the diseases that we've already talked about. For many people who have what we call underlying medical problems, they can get much more intense disease, meaning if you happen to be older, over the age of 70, if you happen to have any underlying medical problems such as diabetes, heart disease, high blood pressure, obesity, all of these things lead you to have increased risk for the disease and increased risk for more severe outcome. We know that in women that are pregnant, their disease usually can present much more seriously than in women who are not pregnant. And in children, children generally do not get infected with the disease. But when they do, they usually have a much more milder form of it. And when they do get sick, African Americans, people of color, those children are more at risk for a much more severe form of the disease called multi-inflammatory system disease. And that causes inflammation of the skin, the heart, the lungs, and the child can be very sick. And in fact, almost 2% of them can end up dying. I'd like to just briefly go over, because I'm not gonna go through all of these slides now because I've basically gone through most of them at this point. I wanted to kind of just tell you a little bit about prevention, because I think that's probably the most important part of this. What can you do to prevent the disease? We know that, for instance, in New Zealand, where they had a leadership that enforced strict lockdowns and masking and sanitation and physical distancing, we know that for those people, they were very, very successful at eliminating the disease. Elimination of the disease was possible just by wearing your mask, physically distancing, and good hand hygiene. So we know that this is a way of preventing disease. We also know that there are other things that can help boost your immune system. And those things are vitamins. Vitamins have been shown and proven through studies to have immune boosting properties. So vitamins like vitamin C, vitamin D, vitamin E, selenium, omega fatty acids, and zinc all contribute to immune boosting and have a role in preventing the disease from being more severe. And so I recommend that you talk with your doctor about the things that you can do in order to prevent yourself from having a much more severe outcome. We know that fatalities are very closely tied to vitamin D deficiency, and Black people in particular, 40% of us are likely to be vitamin D deficient. It's a fat soluble vitamin, so it's also very important that you speak with your doctor to find out whether or not you need it. But it is important, is an important tool in the arsenal for looking at COVID-19. I did forget to talk about testing, and I should tell you that right now there are two different types of tests that are available in terms of the way that they're performed. One is performed through the nose, the other one is performed using an oral swab or getting your saliva. Both of them are almost equally effective. The nasal swab is about 2% more effective than the saliva, but the saliva is less invasive, and people are much more comfortable with that one. And so, and that one is also available in home testing for people who feel that they may have been exposed to the virus. I've listed some of the ways that you can get that. I also wanted to talk to you about long haulers Long haulers are people who have persistence and even emergence of symptoms long after they have cleared the virus from any ways that we can currently test. There's a belief that they probably have the virus still persisting in some tissues, but we're not able to test where that presence is. And what we do know is that for long haulers, they get persistence of very sometimes very debilitating symptoms, loss of taste, loss of smell, which means that their food they can't taste it. It's like tasting cardboard. Many of them have brain fog and very, very intense and debilitating fatigue. This is being studied in a number of centers now, but this is one of the things that, out of all the things I looked at, makes you really want to think about getting the vaccine, because for long haulers, there's no predictive effect of whether or not you were healthy before or whether or not you had underlying disease. This is one of the things that you just don't know whether or not you're going to have that persistence. And we know that I just wanted to just mention that COVID has revealed for us, for people of color, it has revealed longstanding systemic racism and health disparities that we've known to be present for many, many, many years. I know that there's a great distrust when we look at the vaccines, but as we have seen over time, and I know that Anne is going to cover this topic, that the vaccination is one mechanism that we can look to for prevention, and she's going to talk about that. I'm going to also just emphasize just the normal things that your doctor will have emphasized for just general good health, to have a good diet that is hopefully more plant-based than not, to exercise 150 minutes per week is what's recommended, to get adequate sleep somewhere between 7 to 9 hours per night, to get adequate hydration. And that doesn't just mean water, because water alone is not enough. You need to have your electrolytes along with your water. And then finally, maintaining a good social connection and good mental outcome. Whether you do that spiritually or you do that through your friends or whatever mechanism, I think all of those things are very important. And I just want to thank you.
Thank you, Dr. Dr. Alexander. You did a great job given the technical difficulties.
Many technical difficulties.
But it's okay, but it's good information, I think. And I think we'll have some more discussion about that as we start going to the panel discussion.
Yes.
Next up, we're going to be do a little bit of a freestyle here. So I want to follow up with some questions, particularly about the long haulers. I think a lot of people have questions about why it's important to maybe get vaccinated, and there's a lot of questions about what happens when you if you'll need to get the vaccine multiple times, like how we do with the flu vaccine, and if we have to do that, why do we need to get the vaccine in the first place?
So I'll start this by, I'm not an anti-vaxxer, but I'm still a reluctant vaccinator.
Mm-hmm.
And it's for a number of reasons. As you know, the vaccine got emergency authorization. We have 2 vaccines currently that have been approved for emergency authorizations. That's the Pfizer vaccine and the Moderna vaccine. Mm-hmm. Both of them require 2 sets of vaccination. The Pfizer vaccine, 21 days apart, the Moderna, 28 days apart. The Pfizer vaccine requires that you have very severe temperatures in terms of storage. The Moderna vaccine does not. What we know at this time is that both of them are about equally effective, about 94% in terms of prevention. We don't know how long that prevention is going to last, and how long whether or not you will need to have vaccinations in the future. We know that there are several variants out there right now, the UK variant and the South African variant, and both of those variants at this particular time, they are reported to be the vaccines are reported to be effective against. Now, those variants are much more serious in terms of their infectious rate, and I understand the death rate, the fatality rate is also higher for both of those. So it's again a promotion for the vaccine, especially if you're at high risk and you are in a situation where you're coming in contact with people who may be at risk. So, these are the things that you have to talk with your doctor about, because it's a personal decision. You have to decide whether or not your risk is serious enough that the vaccine is going to be something that you should have, whether or not you have the ability to mount a defense that's going to be effective in terms of the vaccine, and whether or not you have any contraindications, meaning do you have any reasons why this vaccine is something that you shouldn't take. Of course, if you've been allergic to vaccines before, neither one of these vaccines have, because they are mRNA vaccines, have been, this is the first time an mRNA vaccine has ever been present. So we don't have a lot of experience with it. We know that it's not being delivered in the way that vaccines have in the past, meaning that neither one of them have the same preservatives, but they're being delivered in this fatty envelope. We don't know necessarily if people have responded because we do know there have been several people that have had allergies or allergic responses to the vaccine. So we don't know whether or not it's to the vaccine itself or to the envelope that it's being delivered in, because that's the only way to deliver the mRNA vaccine. So there are a lot of questions out there. I can't answer them all because we don't know the answers to all of them. And I just want to be honest, because we have to be open and honest about the things that we don't know and the things that we do know when it comes to this.
All right, thank you. All right, so next we're going to have Dr. Yearwood give her presentation. Okay.
Hi, Dr. Yearwood.
Hey, Dr. Alexander.
I have another question while we're waiting.
Okay.
What about, so I have some questions here that I'm going off of. Can you get the flu vaccine or like a shingles vaccine at the same time? Do you recommend getting those at the same time that you get the COVID vaccine?
Well, I'm going to be quite honest. I think that one vaccine at a time is probably the best way to go. That way, if you've had a response to whatever you've had a response to, you have the option of determining if you did have a untoward effect, exactly what it was from. So I would not recommend, doubling up on any vaccines, especially because these are, as I said, emergency authorization use. So it means that they are being released because there is a pandemic, and that even though they've gone under great scrutiny, the vaccines are being released generally, because of this pandemic. If we did not have this pandemic, we would have gone a different way, and I think that's important to say. So I see that Stacey has her slides up. Do you want to start, Stacey?
Sure.
Okay.
All right.
I'm going to go off camera.
Good evening, everyone. I'm honored to be speaking to you all tonight because it is extremely important to use platforms like this one to talk about both mental health and mental illness. Though we all might be on different boats, we are all living through this storm together. Faced with a global pandemic and ongoing racial and political tension, studies have indicated that rates of depression and anxiety have increased significantly since the start of the pandemic, especially for women with school-aged children. Living through this pandemic has presented even more challenges to lives that were already stressed and overwhelmed. For many, this pandemic has led to unemployment, creating unanticipated financial hardships. Financial stress, compounded by kids at home instead of in schools, has led to rising tensions in households. And unfortunately, we have also seen an increase in domestic violence and child abuse. Even for those whose lives have been somewhat unaffected, those who have successfully been able to transition to remote work and may even be in a better financial situation, as now they don't have to think about transportation costs and paying for lunch. But now the problem might be the loss of social connections and feelings of isolation, which may be taking a huge toll. Not to mention those who have lost someone during this time due to COVID or for any reason, now having to find unconventional ways to grieve their loss, as you are unable to gather with friends and family to continue the usual traditions around death and dying that provide relief and solace. Early on in the pandemic, a New York City emergency room doctor committed suicide. And per the reports, she had no history of mental illness. But when you stop to consider the impact of contracting COVID-19, which she did, and returning to a work environment where day in and day out, you're dealing with the trauma of dying patients, knowing that despite your best efforts, you can do nothing to save them, you realize that it's really not that hard to imagine how it could be possible to become so overwhelmed, burdened, to the point that in their despair and in their intense feelings of hopelessness and helplessness, they resort to suicide as their only option. This reminds us that mental illness can affect anyone at any time. It crosses socioeconomic, gender, and race lines. Based on the statistics, there are people that are in this session who are affected. If not you personally, you know someone who is. Several factors influence our mental health. Biological factors like our genes, psychological factors like exposure to trauma or abuse, and environmental factors like poverty. These factors influence how we think, feel, and act, how we relate to others, and how we handle stress. There are many things that happen in our daily lives that contribute to increasing our stress levels and ultimately making us more susceptible to mental illness. Problems at work with bosses and coworkers, drama in our friendships, disagreements in our marriages, conflicts with our children, and then on the more extreme ends of things, the situation that many might find themselves in at this time, dealing with financial difficulties or health crises, our own or among the people we love most. And in the midst of this chaos, how do we prevent ourselves from falling apart? How do we maintain a sense of balance and order when our lives feel so out of control? Today, we are going to focus on using the overall foundation of wellness to protect our mental health. That includes getting adequate sleep, healthy eating, and exercising, which all fall under the umbrella of self-care. Optimizing these three can prevent the onset or worsening of mental illness. First, we need to understand that mental health and mental illness exist along a continuum. When you are mentally healthy, you're in a state of well-being. You can accomplish things, cope with the normal stresses of life, and be productive. On the other hand, when symptoms of mental illness are prominent, your ability to function might be impaired. Symptoms might be so debilitating that you cannot get out of bed. You lack energy, motivation. The things that used to bring you joy, you no longer care about. Your appetite changes. Now you're eating too much or too little, sleeping too much or not at all. You might start missing work or school. These are all red flags and represent signs and symptoms that your ability to cope has been overwhelmed. We need to conceptualize mental illness the way we do any other illness. If you have a cold or seasonal allergies, you can manage that. But if you're in the midst of an acute asthma attack or stroke, you better get to the hospital ASAP. This works similarly with mental illness. When your mood is a bit low or you feel a little anxious, preventive measures and improved self-care might be enough. However, if things have escalated to the point that you are feeling suicidal or psychotic, essentially when people lose touch with reality, intensive therapy and or medications might be indicated. And in the most severe cases, an inpatient psychiatric hospitalization might be necessary to stabilize symptoms. There are levels to this, like anything else. So when symptoms are moderate to severe, professional help is usually necessary. But there are large populations that do not have a diagnosable mental illness. They are just not happy. They're functioning, going to work, taking care of their kids. They're just going through the motions of life, but it's clear that their lives might be void of true happiness, contentment, and joy. Think of these questions for a moment. What do you value? What is important to you? What gives your life meaning and purpose? What do you enjoy about life? What do you look forward to? I always ask patients, when was the last time you were truly happy? Save your answers. We'll get back to that. I think that prior to the pandemic, one of the major reasons that people felt stressed was because there was this general feeling that there wasn't enough time to get anything done, especially in New York. There is this underlying feeling like we're in a rat race, always rushing from one thing to the next. And when we feel stressed, that's when feelings of anxiety and depression can start to creep in. Well, welcome COVID-19. Now, many of us have been forced to slow down. And for some, it has been hard to use that extra time productively. A lot of people, especially in the beginning of the pandemic, spent a tremendous amount of time on social media and watching news programs. And this information overload can, without question, be a very negative impact or have a very negative impact on mental health. Repeated exposure to negative information can be traumatic. I've noticed that people's sleep routines have been completely altered. Many are staying up late, binge watching Netflix, or getting wrapped up in IG accounts and Facebook. And in some ways, these have been pastimes of destruction, in part because they interfere with our ability to get a good night's sleep. Sleep is essential for mental health, physical performance, and cognitive functioning. For people that have trouble sleeping, I need to know a lot about their bedtime routine. Literally, how do they put themselves to bed? In the same way that babies have a routine, bath, bottle, diaper change, swaddle, bed, adults who struggle with sleep difficulties and insomnia need to get back to basics and figure out what calming routine might be helpful to them. Having good sleep hygiene is extremely important. Sleep hygiene refers to the practices and habits that impact your ability to get a good night's sleep. First of all, you want to make sure that you are preparing your body for sleep at night. You can try meditation. There are tons of apps that help with this, like Headspace and Calm. You can take a strolling walk or a warm shower. You can curl up with a good book and a good cup of chamomile tea. You can also try aromatherapy. You can smell lavender scented oils or spray some on your pillow. Also note that caffeine, alcohol, and cigarettes close to bedtime are huge contributors to keeping people up at night. Secondly, you need to make a habit of only using your bedroom for sleep and intimacy. You want to establish your bedroom as a relaxing environment. Stop reading in your bed, watching TV, playing on your phones and computers. The blue lights, which are emitted from your devices, trick your brain into thinking it is still daytime. This interferes with melatonin production, the naturally occurring hormone that regulates sleep and wakefulness. Our mental and physical wellness also depend on the types of foods we eat. Nutritional psychiatry focuses on the science of how nutrients affect our mood and behavior. With food and most things, it's important to just keep it simple. Stay away from processed, packaged, food-like products and eat real food. Exercise is also important for overall wellness. It stimulates the production of mood-regulating brain chemicals, which help to reduce symptoms of depression, anxiety, and stress. When faced with mental or emotional challenges in life, exercise can help you cope in a healthy way. Instead of resorting to alcohol, drugs, or other negative behaviors that ultimately only make symptoms worse. Regular exercise can also help boost your immune system and reduce the impact of stress. So clearly during times of COVID, it is extremely important to get exercise. We all need a way to channel our negative emotions into something positive. Exercise definitely serves this purpose. But in addition to that, a lot of my patients have picked up new hobbies during this time. And for them, it has been incredibly effective at warding off signs and symptoms of depression. Some have started to draw, knit, crochet, read, paint. A few have even started to learn how to play an instrument. Sure, we can lament about all the things that we don't have, people we can't see, vacations that we can't go on. And unfortunately, our brains tend to focus on this type of negative content. So I encourage patients to start a gratitude practice, and it's really simple. I ask them to think about 3 things that they are grateful for before they go to bed. And again, the first thing when they get up in the morning, to also think about 3 things that they're grateful for. Just the act of doing that has the power and potential of transforming your whole day. There is always something to be grateful for. This simple activity serves to retrain your brain, and it also forms the basis of positive psychology. The goal is to minimize negative thoughts and instead to develop a sense of optimism towards life, so that no matter what is going on, your focus is on the positive versus the negative aspects of a situation. In addition to getting adequate sleep, eating healthy foods, exercising, and starting a gratitude practice, our social connections are just as important. People who feel more connected to others have lower rates of depression and anxiety. During COVID-19, our means and ideas of social connectedness have changed drastically. But even during this time, there are many ways to engage with others and to remain socially connected. Phone calls, texting, emails, virtual meetings. We have to find creative ways to maintain the relationships that matter to us. In closing, I want you all to focus on what you value and the things that are most important to you. You are all here today because you care about yourselves, because you want to live your best life and be able to experience joy and happiness even during the chaos and confusion of a global pandemic. To get that, we have to be deliberate in our actions on a daily basis. We have to focus on caring for our bodies and our minds. I hope that I've given you a few useful tools, and I wish you all good mental health and happiness.
Thank you, Dr. Yearwood. That was an excellent presentation.
Yes, it was.
I just have one follow-up question, and we can get into this a little bit later. But my question is, for people who may be feeling anxious or uncertain about getting the vaccine, do you have any recommendations or thoughts that you could share with people who may be feeling anxious about all of this?
I think primarily it's a really good idea for them to talk to their own doctors about the vaccine, because they have to be able to have an idea of the risks that are involved, because there's always risk, but there's certainly a lot more benefits than risk when it comes to this vaccine. So I would talk to your doctor and try to get as much information as you can about it. I mean, there are websites like CDC, the World Health Organization, that are really going to give you accurate information. I think certainly when people are using social media to get their information about the vaccine, people get more anxious because there's a lot of false information on there.
Thank you. Yeah, that's excellent advice. Dr. Maitland, are you ready? Okay. All right.
Greetings and salutations.
Hi, we're looking forward to your presentation.
Thank you. So let me get it loaded on up. Okay. I think it's visible, yes?
Not yet.
No, I don't see it yet.
Okay. It says that I'm sharing. There
I
it
think,
is.
oh,
Yeah, I think it just needs to be,
I think it takes a little time for it to pop up.
okay. So while I'm waiting for it to pop up, just to kind of give you a little bit of perspective from an immunologist regarding the use of medications and interventions to prevent infection, and then to talk a little bit about what you can do if you actually get infected and to prevent the COVID storm, or hyperinflammatory syndrome. And here we are. Yay. Okay. So as Dr. Alexander had talked about regarding COVID vaccine, COVID-19, this was a novel virus that made its way out of China into Europe and now has spread to the US. And you can see that we're still, although the trend is down right now, we're still losing a lot of people to the virus, and still people are being infected. As you know, it's really important, as was discussed, to try to maintain a healthy enclosed space, reduce your exposure to individuals in crowded public spaces, and also kind of reduce your exposure, especially by using wearing your mask properly, for instance. One thing you need to be concerned about as we're approaching spring is when you start having inflammation in the upper airway causing congestion, pressure, sore throats, loss of sense of smell. It's a question of whether or not it's just the virus or you're actually dealing with a head cold or possibly allergens, because we do have a lot of people who have seasonal allergies, especially to tree pollen. And this is just talking about what happens when you breathe in the virus. It actually attaches to the surface area in the nose and sinuses, gets brought into the nose or sinuses, starts killing the cells, and then the immune system gets recruited. And this virus seems to take a while to start causing problems in the upper airway. You can carry it for up to 19 days. And then all of a sudden you start having very severe symptoms. This is to show you that this virus does not impact everyone the same. So children up to 18 years of age seem to be rather unimpacted. It almost feels like they're just having another common cold. What we're more concerned about is individuals who are 18 and higher, where at least 70–80% of individuals will have what seems to be like a cold and will be either asymptomatic or may have increased nasal congestion or upper airway symptoms. I would also like to point out that some individuals actually have gastrointestinal distress. They start having diarrhea, nausea, cramps. So these could all be worrisome for having coronavirus exposure that's now gone past the nose or sinuses. What's more concerning is when after people all of a sudden start having lower respiratory involvement, start having central nervous system issues such as headache or dizziness. And then some of my podiatry friends have noted that they have what's called COVID toe, where you're starting to form clots into the extremities as well. And this is extremely more concerning for people older than 65, where the immune system just is not able to contain it. And so another part of the immune system comes in and starts causing a lot of damage. And so you can find that the major thing that we're concerned about in individuals, and this is again just highlighting the symptoms that we see in individuals that get exposed to the coronavirus. You can have fevers or chills, cough, shortness of breath, fatigue, body aches, and gastrointestinal distress as well. Children seem to get over it fairly quickly. Some will actually may have a rash. This is very rare, similar to a condition called Kawasaki's disease. But if you have a child that has these acute symptoms, test positive, it's important that you contact the pediatrician or family practitioner to make sure they're under control. But again, this is to emphasize, if you have fever, continuous cough, loss of sense of smell or taste, breathing difficulties, or gastrointestinal distress, call your doctor. This is, again, to emphasize we are entering pollen season, so if you have those upper airway symptoms, it's important to get tested and to try to differentiate whether or not you actually have a viral infection or it might be another etiology that may be causing you to have these upper respiratory symptoms as well. This is just a summary of the differences between the different conditions that can cause upper airway symptoms. The difference between allergies and COVID or flu is allergies never cause a fever. And typically, you will have a known exposure with COVID. And again, you can have an exposure up to 2 weeks prior to getting sick. Flu, you feel it within 12 hours. And upper respiratory infections typically focus from a cold, typically focus with having a sore throat or runny nose or sneezing fits. Sometimes you can have some muscle aches, but this typically can resolve fairly quickly. This is just outlining again the different forms of conditions that can have similar symptoms. The biggest concern again is COVID-19, but flu is also a prominent issue, and it's important that not only do you consider getting a COVID vaccine, but you should also get your seasonal flu vaccines as well. Dr. Alexander already talked about risk factors. I'm just going to go very quickly in showing that the individuals that are most at risk for having a bad outcome after being exposed to COVID are individuals that are overweight or obese. As you can see, it is people of color that are more at risk from dying from COVID compared to our Caucasian neighbors. Males are much more likely to be dying from COVID compared to females. And again, you can see that gratefully, death in younger adults is not as pronounced, but as you gain a decade, you can see our seniors are being horribly hit. Again, just to reiterate, an ounce of prevention is better than our attempts at trying to prevent the hyperinflammatory syndrome associated with coronavirus exposure. But again, wear a mask properly, not blow your nose, not to the side. I would almost recommend double masking just to make sure that if you're handling any material surfaces and then touch your face, you'll be touching the outside mask, and the inside mask can offer you more protection. It's important to stay 6 feet apart. Wash your hands, and I'll also add that it's important to use nasal saline to wash out your nose when you get home at night. And then clean and disinfect your surface areas. And as an allergist, I would emphasize that you should use something that is not as astringent that can cause irritation of your airways, because we're finding individuals that have asthma symptoms, the cleaning agents that are being used in public surface area, in public schools and public places sometimes are so strong that they're actually triggering asthma exacerbations. So it's important to be diligent with cleaning and disinfecting, but you also want to be mindful that those can act as irritants as well to the airways. These are some of the preventive measures that I've been recommending, and this has already been touched upon regarding how to maintain good mental health with getting regular sleep, which was so eloquently discussed previously, that it's important that you stay physically active. Being social isolation can be extremely weary on one's physical and mental health. It's important to have a healthy diet. These are just some suggestions of foods that are better for you. Definitely when it comes to green leafy vegetables, fish, chicken, staying away from fried foods, which can cause increased inflammation. So this is a good way to kind of have your body have the ability to fight off infections. You don't necessarily have to use a neti pot. These are two examples of nasal saline. I personally use nasal saline every time I get home at night. Just like I wash my hands, I wash out my nose and sinuses. There was an excellent study from Vanderbilt University that showed that doing nasal saline at night reduce the chances of you converting over to a more serious form of COVID-19 syndrome after coronavirus exposure. And then there have been several supplements that have been shown to be helpful to kind of reduce inflammation, including the use of green tea, oral zinc supplements, buffered vitamin C, luteolin, and N-acetylcysteine. And all of these are available at health food stores as well as some of the major pharmacies. I just wanted to kind of go over what happens with infection and why this is such a complicated issue with the use of vaccines. So what we're finding in the adult population is 4 out of 5 are able to mount what we call the first responder response, where that are components of the innate immune system that are able to battle the virus as soon as it gets into your nasal passages. And for these individuals, if you have a very robust innate immune system response, which includes these cells and these chemical mediators, then it allows the adaptive immune response to come in and form long-term protection. But we're finding in 1 out of 5 adults that their innate immune system is not working very well to clear the virus. And then the adaptive immune response gets exhausted before it's able to form sustained protection. And so these are the individuals that are more at risk for having a not well-controlled initial not well-controlled immune response to the infection, and more at risk for developing hyperinflammatory syndrome, or which is more commonly called the COVID-19 storm. So to kind of battle or to try to augment this innate immune response so that you control the viral load, prevent the virus from being so productive, so far we have at least 2 vaccines that are being used here in the US. So you have the Moderna vaccine. You also have the Pfizer-BioNTech vaccine. And I can tell you in the tri-state area, both the Moderna and the Pfizer-BioNTech vaccine are available. You can see that at the original strain, we have 95% protection, and a report just came out early last week that that these both the Moderna and the Pfizer-BioNTech vaccine are offering pretty good protection against the variants that have been popping up both here in the U.S. as well as Europe and Asia. The AstraZeneca vaccine, which has been offered, as you can see, is not as effective, but it's being used more extensively in countries outside of the US. And then you have the Russian vaccine, the viral vector, which is not being used, but you can see that in Russia, they're actually getting reportedly 92% protection as well. Some of the concerns that patients have regarding the vaccine is whether or not this vaccine will actually cause the disease, and that's not the case because it's only a single molecule from the virus, so it's unlikely to actually cause that type of disease. You can have an allergic reaction or a hypersensitivity reaction to the vaccine. I've had 2 patients in my practice have allergic reactions. And so at this point in time, I'm routinely making recommendations for the use of at least 2 antihistamines to prevent having that type of an allergic reaction. And this is a conversation that you should have with your doctor. If you've had a history of having reactions to vaccines, or you have a history of either food allergies or asthma, may warrant using pre-medication to prevent that type of reaction. We've not seen any dangers in women receiving the vaccine who are either pregnant or breastfeeding. And actually, it's been shown that one study has also demonstrated that both the Moderna and Pfizer vaccine seems to be safe for babies as far as we can tell. But still, we're in the early stages of vaccination and trying to understand the breadth of protection and potential side effects that might be happening from the 2 vaccines that are now being offered here in the U.S. A lot of people are trying to wrangle one vaccine as opposed to the other. I have to tell you, at this point in time, if you're able to get the vaccine, I would encourage you to do so. There are newer variants that are coming up from this virus. In order to protect ourselves and our family members and our community, it would be important to try to get vaccinated in a safe fashion so that you have protection and you're not at risk for developing this syndrome that has already claimed nearly 500,000 lives in this country. Just to talk a little bit about the hyperinflammatory syndrome, essentially what happens is there is an immune response in the innate immune compartment that has the potential of causing activation of the clotting cascade. And those clots start to form in the lungs, in the extremities. There's been evidence of young people actually having strokes from the clot formation that's happening as well. And so in order to prevent these very serious sequelae following exposure to the coronavirus, it's important to undergo vaccination, follow social precautions, as well as use personal protective equipment as well. And I just want to briefly talk about what medications are now available if you get exposed and you develop symptoms that are worrisome beyond the nose and sinuses. So most of these individuals are going to have to be, some of them can be treated on an outpatient basis. I have had 2 patients that had developed lower respiratory distress. This medication, remdesivir, which is an antiviral medication that was developed for another pandemic, has shown some efficacy. But the regimen that I've been particularly prescribing to patients is using a corticosteroid called dexamethasone, along with 2 antihistamines, as well as another medication that's commonly used for asthma. If there's gastrointestinal distress, I actually have been using Pepto-Bismol, which has been shown to have some antiviral activity as well, and is fairly safe to use. Anything more serious, such as if you're having breathing difficulties, if you're starting to have changes in your thinking, if you're starting to see changes in discoloration in your fingers or toes, it's important that you get to the hospital and make sure that you get more aggressive treatment to give you respiratory support, and also to start a coordinated supportive care to see if we can prevent this brewing storm resulting from coronavirus exposure for causing problems beyond infection in the upper airways. To kind of elaborate what might be going on regarding the cytokine storm, oops, sorry about that. What happens is there are cells called mast cells and macrophages, which, if they detect tissue damage, will release chemicals like interleukin-6, as well as tumor necrosis factor and heparin. And this starts causing increased inflammation, not only in the lungs, but there's evidence of this happening in the central nervous system, in the gastrointestinal tract, and even in the kidneys. So we're still very early in this in the treatment phase of trying to put the fire out, but I would have to emphasize that if you become exposed, it's important to start early. Use nasal saline, start clearing out your sinuses. Make sure that you're eating well and sleeping well. Continue isolation and make sure that you have support at home so that you can stay safely and comfortably in your home, and then be able to allow your body to heal from this very serious exposure. It's important that if you start having a loss of sense of smell or taste, you should be evaluated and tested for the possibility of having coronavirus exposure as well. And like I said, the formation of clots not only happens in the lungs, but also can happen in the kidneys. So it's important to understand that infection through the nose can have serious ramifications beyond the upper respiratory tract. And I am going to finish with this note that we typically use at Grace Baptist Church when we give a health moment, and that, beloved, I pray that you may prosper in all things and be in health just as your soul prospers. So I'm happy to address any questions.
Thank you, Dr. Maitland. That was a wonderful presentation, and I learned a lot that I didn't know about. So I thank you for that. There are a couple of questions from the audience that I'm going to start by asking. So Nicole Simone asks, do I have to worry about the nasal saline backing up into my sinuses if I have COVID-19?
No, actually, using nasal saline, especially 3% solution, actually inhibits viral replication. And also, if not, you can also just use a warm sinus steamer. The steam also is another way to kind of get the virus to break up. So there's two things that the virus does not like. It doesn't like concentrated salt water, and it doesn't like steam. So this is a really simple intervention. I have to tell you, every time I come home, I brush my teeth, I use the nasal saline, I take my vitamin supplements, wash my hands, and I'm good to go. And this is despite the fact that I see patients on a weekly basis, and we've had patients come through positive, and I'm grateful for the forces above that I haven't been able to contract anything.
That's excellent. Thank you. There is another question here. It says from Nadia Jones, I think that says. She says, excellent presentation, Dr. Alexander. There's only a 2% difference between the nose and saliva test. Why is the nose test more prevalent? And what about the rate of false positives?
So I'm going to go back on. Okay. So can you repeat that? I'm sorry.
Oh, no problem. She's saying that she was asking about the 2% difference between the
Between
nose.
the two testing? Yeah.
Why is the nose test more prevalent, and what about the rate of false positives?
Okay. So the rate of false positives initially was much higher with these tests, but they have actually been better now than they were before in terms of their sensitivity and their specificity. They basically, for the saline test, is 85%, and for the nose swab, it's 85%, and for the oral swab, it's 83%. That's the current numbers in terms of the difference in terms of the effectiveness and so for false positives, they really don't have a high rate of false positives. What they do have is high rates of false negatives. Or I should say a higher rate, not a high rate, but they have a higher rate of false negatives in terms of the testing. So you may need to go back again if you were negative on the first time, that if you're still persisting with symptoms and you think that you've been exposed, you may need to come back a few days later. And sometimes it's only because, it needs the time to replicate at a point where the test is able to pick it up. Dr. Maitland?
Sorry, I was muted. Did you want to say something, Dr. Maitland?
No. I thought you were.
I was muted. Thank you for indicating. I was just saying that we seem to have some audience interaction here. So there's another question from Nadia. She wants to know, for people who've lost taste or smell, are there any long-term after effects?
So we found that if you intervene with very simple interventions, you should be able to regain your sense of smell and taste. That's a sign of you having active inflammation in your nose and sinuses that's impacting the nerves that are responsible for those sensations. But I can tell you, very simple, using the saline, using the steamer, buffered vitamin C. I've had some patients use oil of oregano. If you can reduce the burden of the virus and reduce the inflammation, your sense of smell and taste should come back. You don't want to ignore those signs. That's the most important thing. You don't want to ignore those signs.
And just one more thing to add in terms of some of the things that you can do. So, nitrous oxide is one of the also immune boosters. So you get that from things like dark chocolate and rhubarb and green leaf vegetables. So I tell people, who like chocolate, if you get the dark kind, that's good for you.
Mm-hmm.
It helps.
Okay, so we have an excuse to have some chocolate.
Yes. The other thing is, by the way, is elderberry too. That's another.
So you have to be careful about elderberry. Elderberry is really good for influenza and bacterial infections, but elderberry can promote interleukin-6. So okay with zinc, okay with N-acetylcysteine, okay. And for zinc, you don't want to do the Zicam nasal spray because that can actually impact your sense of smell. You want to do a capsule, no more than 30 milligrams. Buffered vitamin C, if you're not getting it from fruits and vegetables, you want to do 500 milligrams twice daily. If you want oil of oregano is usually 1 capsule daily if you have acute symptoms. And then I also start patients on 2 antihistamines, which help stabilize that inflammatory response. So Zyrtec and Pepcid, or Zyrtec and Tagamet, or both of them are over the counter, which can stabilize the release of those chemicals that can make that set up that COVID-19 hyperimmune response. And as far, I believe there was a question, nasal spray literally is kind of like, you brush your teeth twice a day, you can use your nasal spray twice a day. And there's nasal saline gel, which can help moisturize the nasal passages and also help protect things that come into your nose and not causing any damage. So there's a lot of conservative, simple, low-hanging fruit procedures that you can do to help yourself stay well.
I think that's excellent advice because I personally haven't heard that a lot. I hear a lot about masking and social distancing, but not so much about, doing these supplemental things. I think that's really good advice. I see another question from President Kersen here. She says, we are hearing more about testing facilities being set up in airports. If someone tests negative for COVID-19 when they arrive at an airport, is it safe for that person to catch a flight shortly after?
I would tell you that, whether you're negative or not, you still need to observe all of the things that you're supposed to do in terms of masking and social distancing and, keeping your hands and, at the hygiene. I think that those are actually much more important than any test. I always say to people, when the person got to get away from COVID, when the person got the venereal disease test that morning and had sex with somebody else in between that time and got infected, that test didn't really mean anything.
Right.
So and I think also knowing that this virus can incubate for days. I wouldn't take any chances. I think it's safe to travel, but when you're on the plane, you want to fly an airline that guarantees that there's going to be space between you and other passengers. And now that the new administration is now enforcing, the use of PPE, not only, for the people who are flying the planes and the steward and stewardesses, it's also insisting that people who are flying also be a good neighbor and wear appropriate equipment. And then, it's amazing the amount of distress just because we couldn't get a consistent message from the top down.
Absolutely. There's oh, go ahead. Sorry.
I was going to say, and it's evidence. We have really good evidence that when there is good leadership, there's a much different outcome. And I use that New Zealand example because there is zero COVID in New Zealand.
Mm-hmm.
And it's all because they did what you're supposed to do, what the science basically tells you to do.
Right.
No vaccination, you didn't have to do any of that.
Thailand was the same thing. And what was interesting about Thailand, they're not as high tech, but 80% of their population wash out their noses at night. Routinely, like they brush their teeth.
I remember really early in the course of the information that I was getting from outside the country is that was one of the things that they said over and over again. And they, talked about alkalinizing your, to drink a, bicarbonate at night with a hot steamy tea, that type of thing, which is what they all do.
And they also looked at the diets. Like they looked, interestingly enough, African countries were more effective.
Exactly. Well,
African countries were more effective than we were.
It became evident when the U.S. wasn't let into Europe, but Rwanda was.
Right. But there's something to be said about diet too.
I had one more thing to add on. I forgot to say, the virus is being seen in the feces. And one of the things they do tell you is that you should, if you think you've been exposed, or if you're in a household, you should make sure that you're putting down the seat, because they do think that the virus is aerosolized when you flush. So if you're living in a home with somebody that may be infected, it's important to keep that seat down.
Mm-hmm.
Yeah, actually, I think that's a good point too to bring up too. Some of the, I don't want to say alternative things, but the things that you hear less of, particularly in the context of New York City, where there's a lot of families who are living in multi-generation homes. Exactly. And don't have the option to, be living alone or have big homes where they can be spaced out. So doing some of these preventive measures, I think, would be really important to pass along and share with people who may not be in situations where they can do that. Dr. Yearwood, there's a question for you here. Nadia wants to know, how can folks counteract the extreme fear factor around COVID-19, with some folks, for example, refusing to leave home?
Meaning that they're fearful of leaving home because they fear contracting COVID-19?
I think so. I think that's her question.
Okay. I mean, I think that with anything else, this is a situation that's not going away fast. And, we all have to figure out, like, how are we going to live with it in a healthy, safe way? And I think that there's been enough time to sort of gather that information. We know what we need to do. We need to wear masks. We need to be socially distanced. If you do feel uncomfortable about going out, if you don't have to, then don't. But I mean, to do the things that you need to do, there are ways that you can protect yourself. You can double mask, like Dr. Ann said. You can be sure that you're keeping space and distance between you and someone else. So it's one of those things where if it's a rational fear, this is a rational fear that people are having. However, because there's information, because there's ways to protect ourselves, we need to just utilize what we can in terms of preventing the illness and, continue on with our lives.
Yeah, absolutely. I think so too. And I would say, I totally get the fear around contracting the virus. But I think there's still some things that you can do in terms of getting out and getting fresh air where you don't necessarily have to be around people, but it can give you a change of scenery from just being inside all day. And then there's also opportunities, I think, to take advantage of, if you have the technology available, is to maintain interactions. I think you mentioned this in your presentation, Dr. Yearwood, with friends and family through social media, through Zoom, texting, phone calls, whatever you can do to keep those interactions up, I think is something that would be helpful. Sorry, looking at these questions. Dr. Ann, do you have something that shows that what we should and shouldn't intake on the internet?
So there are a couple of websites that I can share with Dr. Garrison and Dr. Alexander that I feel are good resources from a supplement standpoint to help. The American Academy of Asthma, Allergy, Immunology and the American College of Asthma, Allergy, and Immunology has some recommendations regarding treatments as well. But I think the one thing that has been consistent has been the nasal saline and the warm sinus vaporizers. That's just, if you get that, if you wash it out, the virus won't have time to set up shop. I mean, and that's a no medication risk factor. Water and salt, I think is extremely important. And then a healthy diet, like Dr. Yearwood brought up, healthy diet, and Dr. Alexander brought up, eat well, sleep well, and make sure that your body, because stress will open up the door for you having your immune system go unchecked. So I think it's the basics in that respect. But I'm happy if you I will provide my email, and feel free to email me, and I can send some sites that I think are a little bit better vetted than Dr. Google. So
Thank you. Okay, I think we'll go into getting into some different questions. Someone brought up the double masking. Is there a particular kind of mask that people should be wearing? I've heard talk about the surgical mask, and then there's the cloth mask. Does it matter what types of masks you double up with, or should it just be 2 masks, period?
I think using the cotton mask as the one that's closest to you, and then disposable surgical mask over that is probably the best combination.
Okay.
You don't want the cloth mask that have that little vent, because it does nothing. And then, you know, people who use the ones that slip up and slip down, but if they keep on doing that, it really, they're at risk for touching a surface and then bringing it close to your face. I mean, so the main reason for the mask is to prevent you from touching a surface area and then bringing it to your face and then introducing it that way. So double masking reduces the chance of particulate matter being respired through your nose passages or entering through your mouth. So I would keep it simple with, you know, your favorite African cloth mask, and then your surgical over it.
Okay. I think.
Can I just add?
Oh yeah, go ahead.
Let me see if I can. Yeah, I was going to say that one other thing that you can do with the cloth mask, some cloth masks have the ability to put a HEPA filter in, which is the same filter that you can get, you know, it's the same filters that they use for allergens in the, you know, when you're vacuuming and stuff like that. And if you cut that out and put that in between the mask, that also gives you another layer of protection for the cloth mask. And a lot of people do have that ability to have like that third layer in between. It actually filters out more. It has the ability to filter out more particulate matter.
Okay. I have another question here. A lot of people are wanting to know, especially if they're okay with getting the vaccine, if they can get it, and just in general, about when can we get back to quote unquote normal life? And, you know, if, for example, you get both of your doses of the vaccine, can you then just go back to the way things were in 2019?
The problem with the vaccine is it doesn't necessarily prevent infection, right? So you can still carry, and you might be protected from developing that hyperimmune response, but you might not necessarily, but you still have the opportunity to share with somebody else. So we're, in my opinion, easily a year away from opening up a little bit more. You still have a lot of non-compliance and non-adherence to the policies. The new administration has only implemented policies within the past 3 weeks, and we're still seeing social events happening. I was in a pharmacy the other day, and this person stood 1 foot from me without her mask, and I just asked her to put her mask on and step back, and she started yelling at me. And this was a person of color. And so I just said, look, you know, you don't know what I got, and I don't know what you got. I'm just asking you, my space, your space. And so there's a lot of this, and I think Dr. Yearwood had addressed this. There's a lot of anxiety, and people might not necessarily have the resources to deal with all that angst. I think until we're a little bit we're even having a shortage of vaccine now. So we have seniors who've not been vaccinated yet. And so until they can improve the delivery, until we can get over the fear of the vaccine, because some people are fearful and understandably so of it, I don't know, Dr. Yearwood, Dr. Alexander, I don't anticipate us getting back to a, normal semblance of life for a while.
So I like to use history. If you look at the pandemic, the Spanish flu pandemic in 1918, it took approximately 2 years for it to run its course. And the same expectation is, I think, for this virus. I don't think that we're going to be out of it, as you've already mentioned, for probably another year with or without a vaccine, because herd immunity, which is really what we're seeking, is unlikely to occur even with the vaccine within this year. So it's going to take, they said, even best guess that we will probably have at least another year of this. And certainly, whether you have the vaccine or not, you still need to continue with masking and physical distancing and hygiene precautions. So I don't think that that changes much until about a year from now.
Yeah, I feel the same way too. Another question that has come up is about if, person A is vaccinated, fully vaccinated, and person B also is fully vaccinated. What about those types of interactions? Can we interact with one another without physical distancing and wearing masks? Would it be recommended in those cases?
So I have a question. This is my question, because you really need to know whether or not you have developed antibodies post-vaccine.
Mm-hmm.
We know that the vaccine is 94 to 96% effective. What about that 4% or 6% people who it's not effective, who do not develop antibodies as a result of the vaccine? Which group are you in? And I think that's important to know. So if you got vaccinated and the other person got vaccinated, is there a guarantee that you have antibodies? I don't think that you can say that guarantee unless if you're known to have antibodies. And we also know that people early, so it takes about 2 to 4 weeks after the second vaccine to be fully effective. So I would say, again, you need to know when did you get vaccinated? Which vaccination did you get? Right now, the Pfizer BioNTech and the Moderna are the two that we have. But we know that Johnson & Johnson's coming out with one, and that one is 68% effective.
Mm-hmm.
So, you need to know whether or not you've developed antibodies. I think that's the real question. And, we know that there are people who have had COVID, and this is very rare, but they have gotten it again. So
they just came out with a really interesting study looking at healthcare workers who were exposed to COVID, and they show close to a 30% drop off of the protective antibodies within months. So this really is a question of not just antibodies, but the first responder response as well. So
and I have a question, because for those people who have underlying immune compromised systems, what about them and this, and vaccination? Do they actually do they have the same ability to mount an immune response like a healthy person? Do they maintain that? Do they maintain that response?
We don't know. We don't know, because up to this point in time, we're not even, it was only like a month and a half ago that they thought that asthma was an increased risk factor for developing COVID after coronavirus exposure, and that has not panned out. And so I can tell you that individuals that were so they looked at cohorts in Italy, like Bogoma was hit extremely hard, and they had liver transplant patients there, and nobody died. Right? So it's not the virus that's killing people. It's whether or not you can mount that hypersensitivity response. And it's very possible, and I'm hand waving here, but it's very possible if you have an immunodeficiency or you have a pre-existing hypersensitivity disorder, or you're on medications like Actemra for rheumatoid, rheumatoid joint disease, or Dupixent for asthma and sinus polyps and atopic dermatitis. You might already be on an anti-inflammatory or an immune distracted state that you can't mount that hypersensitivity response. So I would have to say that we need more data, but up to this point in time, we're actively vaccinating immunodeficiency patients, and we're actively vaccinating asthmatics, food allergy, delayed hypersensitivity responses like lupus and rheumatoid arthritis and inflammatory bowel disease, because I'd rather err on the side of protecting than not. And I think that's been the approach up to this point. That's why they just started the rollout for people that have chronic inflammatory disorders.
So have they been testing those people to find out whether or not they mount an antibody response to as a result?
You can't, because some of them are already on IVIG, so you can't even check for the antibodies because you can't check. These people don't mount antibody responses. So the only thing you can do is challenge them. I mean, do you really want to take that chance, kind of a thing, right?
Yeah.
Right. So, in this country, 11% of the population has asthma. Period. And we don't. And then we have individuals that have, on average, people who have immunodeficiency will suffer with the immunodeficiency for 12 years before they're diagnosed. And so I think, again, the benefit of getting the vaccine, we've been routinely vaccinating patients that are immunodeficient, not knowing that they're going to develop an antibody response, but there are other components of the immune system besides antibodies that may be protecting individuals. And so that's what we're hoping to cultivate in individuals when we do the vaccine. So.
Excellent. You brought up some good points about comorbidities and that these things are often experienced at a higher rate in Black and Brown communities. There was a question I had here about whether or not the vaccine was tested in the clinical trials in these populations of people to know that it's effective for certain populations such as Black and Latinos.
Data's not there yet.
Okay.
I can tell you the data's just not there yet. I would have to say a lot of resources are just, well, first of all, there's a huge distrust in the Black and Brown communities regarding participating in clinical trials. Dating back to, syphilis trials and, eugenics. There's a huge distrust with African Americans and Latinos participating in clinical trials. And right now, I think the battle and I don't know, Dr. Yearwood and Dr. Sly, what your thoughts are on this. There are a lot of people who are reluctant to get the vaccine and are willing to stay isolated rather than get vaccinated. And I think, people have to make a decision on how they want to live. And I just think that's a horrible way to have your last days, as just so socially isolated due to fear. So.
Yeah, I think one of the things that I feel encouraged by a little bit is the fact that people are asking questions about the vaccine. They want to know more about it. There's a lot of feedback. Dr. Alexander, can you put yourself on mute? Okay. And so I think that, it's good to ask these questions and to also recognize some of the things that you mentioned about mistrust and the history of treatment of Black and Brown communities or in medicine and even to today. But I think that it's important. Another thing that I'm seeing that's happening is that even for the vaccine, there's a bit of an unequal distribution of vaccines and who has access to them. And so I think that's something that we also should be paying attention to so that, we don't put ourselves in a situation where even more disparities are being created around vaccines.
Well, there was a story in the New York Times where they were seeing non-Black and Brown people showing up in predominantly Black and Brown communities, jumping the line.
Yeah.
So it's a shame that we have to start looking out for ourselves and try to address the fears directly regarding why are you scared of this vaccine. I have to say, Dr. Corday and I both got on our respective Facebooks showing that we got vaccinated and without complication. I mean, no different than trying to protect yourself against, tetanus. So I think it's important to let people know we need to put our faces out there and show, we're the ones who have those resources to show that we need to this is the way we can help each other.
I agree with you, Dr. Anna. I think there really needs to be a more effective sort of public health campaign targeting communities of color in order to sort of mobilize them to want to get it. But I think that just the way everything was rolled out didn't really help people to feel confident and comfortable with the vaccine.
Absolutely. I see a couple more questions from the chat, and Max Spin says, do you still need to be COVID tested regularly after being vaccinated?
You do, because you can still carry the virus. You're just not at risk for developing COVID. So if you want to make sure that you don't get exposed, if you have an exposure, I think it's important because then you should be quarantining. You're still at risk. This is unlike other viruses. This is to prevent COVID, not to prevent coronavirus infection. And so, yes, you still need to be tested if you think there's been an exposure.
Right, particularly for other people around you so that you don't have a chance of infecting them. Another question here is from Nadia saying, recently there was a report of a third vaccine being needed. Do you have any information about that? Not sure what that is.
I don't know if there's a third vaccine coming out. Dr. Alexander had brought that up before, but it's been shown not to be as effective. It's a different vector. So the Moderna and the Pfizer are mRNA vaccines that need special storage. The one that's coming forth is it's actually borrowing an adenovirus. It's borrowing from another virus to do the delivery system. And so it's not been shown to be as effective. But if you have communities, and there are plenty of countries that don't have access to vaccine, you rather have them have something than nothing. So I don't know, that's not necessarily the course that the US is pursuing. Now, another argument that was being batted around is, well, why don't we just vaccinate everybody once and then come back and do the second? And at this point, that's not, NIH is standing firm on the 2-shot protocol.
Yeah, I think some people also are waiting for the single dose from Johnson and Johnson because they didn't want to have the have to take the two doses. But I think, if you're interested and you want to get the vaccine and you're able to, I think you should get whatever one is available to you at the moment.
And you have to be in the group that's even they're giving the vaccine to, because it's not available to everybody. That's the other part of this. There's a lot of dissension about vaccines, but a lot of people who are dissenting, they wouldn't be offered the vaccine anyway. Now, we know that people of color have a much higher risk of COVID because of the conditions that we're subjected to. I mean, the health disparities, the fact that many Black people are working in as essential workers. They're coming in contact with other people that may be infectious every day. So, but not all of them are even eligible. I mean, we talked about this before. Grocery store workers and FedEx people, I think, are probably have a significant risk, but I don't think they're on the list.
Yeah, I think, that is contributing to some of the disparities that we're seeing, and there needs to be some changes around that, for sure. You're absolutely right with that.
And then let's not forget the prison population, and there's so many different, and the prison population in particular, because we have a large male population where they're institutionalized, and we have no idea what is happening in many of those situations, whether or not are they being vaccinated.
I don't think they are in New York. No, I think in some other states there's a little bit different rules around that, but not in New York, which is a shame.
Yeah.
All right, there's another question from the audience here. Carol Davis says that she was under the impression that the Moderna vaccine was tested on people of color, but not older adults over the age of 65. Wants to know if that impression is correct.
Yeah, she's actually correct. I think that no one over 70 was tested in the Moderna trials. I don't think anybody over 70 in either one of those trials. I don't think they had the older population included in the trials.
Yeah, I think one thing they're starting to do, though, is they're starting to recruit at historically Black colleges along with alumni to start doing a little bit more intensive investigation. And I think they just started aggressively vaccinating in nursing homes as well. But again, there's a huge healthcare disparity on the delivery to communities where that's the case. So unfortunately, there's a huge literacy problem also. There's so many barriers to care regarding Black and Brown communities, regarding access to the appropriate information, hearing the information from somebody that you trust. And so I think historically Black colleges are stepping up. I know the churches are stepping up. Grace Baptist Church actually was able to have a relationship with one of the local community centers, and they went and actually brought seniors in to make sure that they were getting vaccinated. So we have to start relying on the institutions where there is faith built in, the churches, the schools, the government officials that were elected by our communities, to kind of step up and start, letting them know that they've been educated or not. I have not heard of any, we do know that African Americans have been vaccinated who are above the age of 70. I can tell you my mother, who's 89, successfully got vaccinated, and 3 of her friends who are all like in their octogenarians all got vaccinated without complication. So
that's wonderful news. Wonderful. I think we're going to wrap up. I wanted to leave the floor open for you all to leave any closing or have any closing remarks if you wanted to say anything to close us out.
So I just wanted to thank the coalition for bringing this. It's very important to get this information out to our community. And I think that I want to thank Dr. Ann Maitland and Dr. Stacey Yearwood for participating in this event with me. I really appreciate the information. I learned a lot myself.
I echo the same sentiment. This was a wonderful opportunity. Dr. Alexander, thank you for inviting me. Dr. Yearwood and Dr. Sly, it's been a pleasure. And I look forward to further communications because COVID isn't the only thing that's plaguing our communities, and it's opportunities like this where we can raise the level of awareness and education by people who look like us, which is a beautiful. Can I tell you how beautiful it is to see women of color doing this? It's amazing. It's amazing. Thank you.
Yeah, and like I said, it's really important to be able to use platforms like this one to educate our community. I think this was great. I'm glad that Dr. Alexander asked me to participate. And again, there are lots of actual valid resources online that you use, and we'll be sure to post them at the end of the video.
Excellent.
Dr. Sly, I really want to thank you. You did an excellent facilitation of this program. Thank you very much.
Thank you all. I learned a lot too. I'm really happy to be amongst a panel of such esteemed Black women. And I hope that, like Dr. Ann said, that we can continue to have these conversations. All right. Thank you, everyone.
Thank you. Bye-bye.
Bye.